Welcome back to the Healing Wellness Show. I'm Dr. Karim, and today again we have Amanda, our nurse practitioner. What we're going to do is we're just going to dive deep into exciting things that a lot of people are talking about, which is stem cells. So if you're wondering what stem cells are, how they can help with like injuries or chronic pain, or even just wellness, you do use it for wellness quite a bit, don't you? So this is what this episode is all about. So Amanda, again, just why don't you just introduce yourself for people that are new to the channel and just tell them a little bit about you.
Started my nursing career as an NP. I started in pain management, physical medicine, and rehab, and then have in 2020 I joined Iowa Wellness and have just kind of expanded and grown into this wellness functional medicine space. That's awesome. Lots of things we're able to do and bring to our patients in a holistic way. So I'm excited. I'm excited for this.
Good. Well, this episode we're going to do a little bit different. I think Amanda and I are just going to collaborate with our experiences with stem cells. We do work together sometimes at Iowa Wellness Center, and I mean we've seen so many patients with stem cells, right? For what, the last 5 years now. So let's start with, why don't you tell us what exactly are stem cells?
You'll hear called mesenchymal stem.
I say mesenchymal.
Yeah, I say mesenchymal, so whatever. But anyways, we use the mesenchymal adult stem cells primarily for joints, neuropathy, hair, skin. We use them for a multitude of reasons. But we also use a component of the stem cell, which is like a nanoparticle of the stem cell called exosomes. And we use those a lot of times for infusions. So we kind of have a little bit of a mixture of both, but the stem cells are great because they can differentiate and they have the ability to self-renew as well. So you pretty much can use them in a lot of different areas. And like you said, we do. So
how do they differ from other cells? Because you said they're different from other cells. So how would you say they're different?
So they're kind of the master cell. They have the ability, like I said, to self-renew and differentiate themselves. They can multiply rapidly. They're used, like I said, in a multitude of different ways, from joints to they can be injected IV and then for cosmetic purposes too. So they're great.
Yeah. Yeah. So, I mean, with stem cells, just like Amanda said, I mean, I explain it when I explain it to the patient. I basically just dumb it down and say, well, I'm going to give you an analogy, right? So think of an orange. Obviously, stem cells you can't see with your bare eyes, so just bear with me with this analogy, but think of as mesenchymal stem cell as an orange. It's big, it's bulky. Those are the ones that we can use in joints. So that could be your knee, your hip, your back, your neck, your shoulder, so any joint. You have to be really specific on where you put them. So say you've got knee pain and it's on the inside of your knee. Well, if we put them on the outside of the knee, it's not going to work for that area. So you have to be really specific on where you put them. And when you put them in that area, they don't move around. The other one is, so I go back to that orange, is inside of the orange there's pulp. That's that nanoparticle, the exosome that Amanda was talking about. So doctors figured out we could take those out, we can inject those through the bloodstream. Those like to travel. They can go throughout the whole entire body. Yeah, they're also so small that they can cross the brain barrier. So doctors right now are using those with like Alzheimer's, dementia, Parkinson's, MS, ALS. I know in the clinic we've used it with quite a few MS patients. We've used it with neuropathy patients. I mean, lots of different conditions there. So that's the easiest way to kind of know about these different types that Amanda talked about. So Amanda, why don't you maybe tell us about the different types of stem cells, or like how can you get stem cells? Where from?
Obviously, you can get them from fat cells, you can get them from bone, but we find that the umbilical cord placenta is superior over those because obviously if you're harvesting stem cells from, fat or bone, it's that person's age, right? So doing the placenta and umbilical cord derived, it's pretty much age 0. So they have a lot more potency. And the key is you're going to get a lot more stem cells from them too. So an 80-year-old, might produce what, 200?
Yeah, so it's based off of that study where they did a control study on 80-year-old, 30-year-old, and the umbilical cord, they called it 0-day-year-old. The 80-year-old, they took one stem cell out of their body, and then they put it in a petri dish, again in a controlled study, let it multiply over a month. It created 200 stem cells. They did the same thing with a 30-year-old. The 30-year-old, they let it multiply over a month. and then it created 32,500 stem cells. When they did the brand new, the umbilical cord, well, guess what? That created a billion. So that's why as you age, you get less and less stem cells. They're less and less effective. That's why we don't use your own in Iowa Wellness Center. We use the donated. Now, there are a few criteria for that. It has to be a healthy mom, healthy baby. Has to be a C-section. Can't be natural birth, because with natural birth, your vaginal wall can compress on the cord, or you can get vaginal diseases on the cord. And then it can't be aborted babies, because with abortion, you're yanking and damaging that cord. So it has to be a C-section. Mom has to agree to donate the umbilical cord. If mom agrees to donate it, then the stem cell company takes it, does extensive testing on it. So if there's no disease whatsoever, that's where it passes. That's where they take the umbilical cord and start extracting out the stem cells. So that's how they're harvested and tested. There are, let's ask you that. I mean, where do you get them from? Like labs or like hospital? Where can you go get stem cells? Or like for Iowa Wellness, where do we get our stem cells from?
We get ours from an accredited, certified lab. Like he said, they go through extensive testing. We get the report of everything that it's tested against to show everything is, negative, zero, all of the things. There's actually never been any adverse events reported through BD Labs. So they're a very reputable, like I said, accredited company that we get it from. So we've never had any issues, and, they're very safe.
Yeah, and they've been around. They actually work with the FDA. Like pharmacy companies, they have to give, I think it's 20% of what they produce for FDA to test. They actually do the same thing, where they send it to FDA to have them test it, because they are working right now with FDA to try and improve a few conditions with stem cells. So they do a lot of research and stuff like that. So, yeah, I mean, they're a great company that we've been with for a long time. Some of the questions here: what conditions or injuries, or what do you use stem cells on? What kind of conditions or injuries or conditions?
So really, you can use stem cells just to say we do the most with knees. I've also done a few shoulders, a lot of IV, also for neuropathy, and then cross over into the cosmetic space for hair restoration or facial rejuvenation. We can use it there too. We also have stem cells for patients with some visual, so we can get them as eye drops too. So really, I mean, there's a multitude of ways you can use them, but those are just the predominant ones that we use at Iowa Wellness.
You've also used them for vaginal, yeah, erectile dysfunction, vaginal.
Yes, I do also use them for what you'll hear is the P shot and the O shot. So erectile dysfunction for men, women.
So how does stem cell help with, say, someone has inflammation?
So they're a good piece to decreasing the inflammation. And I think the biggest thing is regeneration. So it really helps the cell regenerate. It also helps recruit your own body stem cells that sit dormant, recruits them to come help and restore and regenerate as well.
So how can stem cells eliminate maybe the need of doing surgery?
So, I mean, a lot of patients are, they don't want to go under the knife again, or they've had a bad experience, or they want to try other things first. So I don't want to say there's not a need for, surgical interventions, but I think, again, if you can start with stem cells or, other conservative treatments first. I've seen stem cells allow patients to heal and not need surgery. So I've also seen the other end where patients do have surgery and they're either worse off or still in pain, and they come to us because they don't want to do it again, or they're wanting other options. Stem cells, I mean, it's painless. I tell my patients the worst that could happen is nothing. I mean, we're pretty much 50-50 when it comes to stem cells. We can't guarantee anything, but I think it's, if you can, I think it's something definitely too.
I'll give you an example. Like, we've had so many people come in and say, my doctor told me my knee's bone on bone, right? We have to do that. For us, we have to do our own evaluation, examination, x-rays, and then we can determine whether, yes, you might be a fit for the stem cells or not, right? So if you are true bone on bone, and truly, you're bone on bone, you shouldn't be able to bend your knee, okay? That's where you've got that bone on top of that bone. And we've had a few cases like that where we're like, no, you actually need surgery. Right? But if you still have some disc space in there, That's live tissue. That's the tissue that we're looking for to try and regenerate to get you more disc space in that area so it can regenerate that and have that knee feel better or take the pressure off. If you don't have it, we will tell you. You know, sometimes we're like, I don't know if you have, it's a 50-50 thing because it's barely a space there. And we'll go, it's up to you if you want to try it or not, you know, or if it's not, we'll tell you it's not. And it's a waste of money to do it. There are clinics out there that we've heard of that's all they do, and they don't even do imaging, and they're like, oh yeah, we'll put stem cells in there and we'll make it feel better. It's like, how can you tell if there's live tissue? So there are cases like that where they say, oh yeah, it's bone to bone, but it's not. I mean, we had it with a shoulder as well. Amanda, so why don't you walk us through what a patient would, you know, typically go through with a stem cell treatment? Let's start with that joint.
So I think the biggest thing is one, it starts with a complete history and physical. What did was there an injury or what are we dealing with? And then stemming from there, what have you tried? What modalities have worked? What has not worked? We then kind of can start talking about stem cells, but we need to look at everything else too, as far as, is this patient overweight? Are they taking a bunch of medications? Old are they? Because all of these things are going to impact how well these stem cells work. We need to we need to sort of put all the pieces together and have all of these things working in collaboration together so that the patient can feel the best. So it's not just, oh, you have knee pain, great, let's come in and do stem cells. There definitely is a workup and there's conversations and lots of patient education to be had. Maybe we don't do stem cells right away. Maybe we need to work on weight loss first. Maybe we need to work on gut health. Maybe we need to work on, stress management or sleep, whatever it may be. We need to fix all of these things first before we just rush in to do stem cells. And when you explain that to the patient, they're very open to that and they agree. So we really need to make sure that we're finding the right patient, making sure they're a good candidate, but also doing all of the things from a lifestyle holistic approach that's going to enable them to have the best outcome with the stem cell therapy.
Yeah, I mean, like Amanda said, I mean, we want to recommend what's best for the patient. If they're coming seeking the stem cell, which we do have, we still have to educate them. I mean, if I have a patient in front of me that's overweight, I have to educate them like, hey, we should try and get off as much weight as possible before putting the stem cell, and that's how it's going to actually work the best. Because every pound that you're overweight, you're putting 4 extra pounds of pressure on your joint. So there's no point doing the stem cells until we get that weight off, so it's not that much pressure, and you're actually, a lot of times their joint pain gets better just by getting the weight off. But I mean, if there is damage in the joint, then yeah, we'll put the stem cells after they've rehabbed, or say we do knee traction because the bones are misaligned, so we need to align them back in before we do the stem cells. So it really all depends on that patient. You did mention medication. I want to put this out there because we've also had that where, patients might just gotten a steroid shot in their joint. Well, we won't put stem cells in that area until, 6 months sometimes. Because when you put that steroid shot, well, you're killing the cells in that area. Well, we need the cells to regenerate when we put the stem cells. So that's why we got to wait. So there are things like that we need to figure out before we go, oh yeah, we're just going to throw a stem cell in there.
Even orally too, seeing those symptoms of inflammation.
So how long would you say a treatment typically takes, and is it painful?
So the actual procedure itself is very, it takes 5 minutes maybe, depending on what we're doing, but it's not painful. Patients, they do very well as far as pain wise. Like I said, really the only contraindication is the NSAIDs. They're able to resume activities right after. Obviously, no vigorous activities. We don't want to, cause pain or anything. So light activity, but they're very well tolerated.
Yeah, yeah, I would say so. I mean, a lot of times we'll tell them, hey, don't go like squatting or lifting heavy weights, or, or going a big hike, but you can still function. You can still go back to work even that same day you do them. So it's not that hard. Okay. So the biggest questions that we usually get is, hey, is there any risk or safety concerns or effects from doing stem cell?
Experience, no. Like I said, the worst that can happen is never had a patient say, it caused this or this or this. Most of the time we follow up the next day or the next couple days and patients feel I'm good. I have nothing to report. I have, from experience in the 5 years I've been injecting stem cells, I've never come across any of that. Obviously, there are contraindications to everything. Obviously, we're not going to do stem cells when someone's pregnant or breastfeeding, trying to conceive. No one with active cancer or proliferative diseases. We have a pretty good informed consent we go through and address all of those things, but for the most part, they're very safe.
So, based back again to FDA, with stem cells, there's no side effects, no one side effect. And that's why we're able to use them right now because they're FDA regulated. They're not FDA approved. So, FDA says, yeah, you can use them because there isn't a side effect. If there was one side effect, we wouldn't be able to use them until we figure out all the side effects or what it's for exactly, just like a medication, right? A heart medication. Well, maybe it helps with pain as well, but if it's FDA approved for just the heart, you can't prescribe it for that pain. So it's kind of like that where it is regulated, but there isn't side effects, so we're able to use it right now. So why do you think stem cell is misunderstood?
I think the biggest thing people say is, you're killing the baby or that kind of thing. There's some sort of.
Yeah, it's usually they think it's from aborted babies, and it's not.
So the biggest thing is there are embryonic stem cells, and those stem cells are made in vitro, just like in vitro fertilization. And then once those embryos become embryos, you can use them either for research or patients can donate them, but then, they can be destroyed too. So there is some controversy with embryonic stem cells in that regard. However, they're not used often. We do not use embryonic cells. I don't know who uses embryonic stem cells, if any, but they're just really not used in medicine and kind of what the stuff that we do.
So what are realistic expectations for results after a stem cell therapy?
Yeah, so I mean, I tell my patients not to expect anything instant. I say usually, it could take 3 to 4 months for them to start to work. And how long do they work? They could work for years. And so it's having that conversation. Will you need more in a year, 2 years? Obviously, it depends on what we're treating, how the patients respond, but you're still aging. Oh, your body is still, going to maybe need some maintenance as you age. If you get re-injured or have another injury to the site, you might need some more stem cells. It's really a case by case basis. That's what I
Yeah,
tell my patients.
I always tell my patients, whatever we're doing for you, whether it's stem cells or our treatments or anything like that, we're doing it for your body. Your body is the one that heals itself. Your body is the one that's going to dictate how long it takes. We don't know. Everyone's different. I mean, with stem cells, we've seen it where some people it's in a week, they're great. Some people it's months. Some people it's years. We had someone that after 2 years, they're like, oh yeah, everything's gone. But it took that long. So it could take a while, or it, like you said, it might not do anything. But it probably did something. I would say you had more inflammation, more toxicity, and it just, it did do a little bit, but you needed more. So what would you say, like, stem cell therapy evolving in the next few years? Where do you see it?
You know, I think that they'll be FDA approved in that time, hopefully. I think more research is needed. I think just being an advocate and educating patients, kind of moving the needle a little bit. I'm hoping that they're utilized more and more, but I think there's still some hesitancy and controversy, and all we can do is just get the information out and educate patients. I don't know. What do you think?
I think as the U.S., we're a little bit behind because of regulations like the FDA, because stem cells have been around. I mean, there's a doc that opened up, he was American, opened up down in Panama, and really, I think he's the reason why we're able to use them in the U.S. now, because he did a lot of research, and he does have a lot of people that fly down there and does stem cells and great success. There's a lot of athletes a few years back before this, stem cells are popular now, that were flying to Europe to get them done. I mean, Kobe Bryant, when he injured his tendon, he went to Europe and got stem cells in him. So I think we are advancing. We're just always a little bit behind for some reason, but I think there are going to be great things with stem cells. So how can someone get evaluated, see if stem cell therapy is a good option for them?
You can see what's been going on, get a good history, get a good idea of how we approach this, collect all of that information, and then form a plan for that patient. whether it's stem cells or maybe it's not stem cells they need. Maybe it's hormones, or maybe it's we need to focus on gut first. So no matter what the issue might be, there's somewhere we can start.
So, what questions should our listeners ask when choosing a provider or a clinic for stem cell therapy?
I think obviously making sure they're asking where they get their stem cells, making sure it's an accredited lab. I then also think it's good to ask them how much stem cells are they getting? You know, are they getting a few thousand? Are they getting a billion? Obviously what the cost is. But like he said, our exosomes, you're getting 75 billion. So that's obviously it's a lot. So it's a good question to ask when you're considering spending that. It's an investment, right? So making sure you're getting your money's worth, if you will. And obviously you want to be able to trust these people and feel good about your decision.
Yeah, I would say, yeah, definitely asking like what type of cell is it? Is it the nanoparticle or is it the mesenchymal stem cell that you're injecting in me? How much am I getting? It usually goes by how many billion or million. So, especially if you're shopping, then know how many billion you're getting from here compared to here. Because some people, yeah, I mean, we had an instance last month where people harvested their own stem cell and wanted that injected back. And when I asked them how much they have in it, and I think it was like 750 million, and it costs, I think, close to triple what we charge for a 75 billion. So it really all depends on where you get it, what you're doing with it, and these are good questions to kind of find out and ask. I'd say any patient that stands out, testimonials or anything like that.
I mean, I've had some pretty awesome knee turnarounds. Patients who no longer have pain going up and down the steps. Patients can now get back to their running. I had one lady who was unable to go up and down steps. They had to pretty much put her bedroom in the living room because she could not go up and down her steps. And now not only is she able to go upstairs to go to her bed, she's able to travel now. Pretty life-changing when it comes to that. So I can't imagine being, trapped to that one location and your life being so detrimental to your life. I mean, so that was awesome. I also have treated a guy with Parkinson's.
I was
He
gonna
was
say that
having
story.
some tremors, and he came in and he said, I got stem cells right when I was diagnosed with Parkinson's, and my tremors went away. And this was 4 years ago, and now I'm coming to you because I can start to tell that they're coming back a little bit. So he just came in for an IV of our exosomes, and off he went. So I haven't seen him in about 3 years now.
Yeah,
So
yeah. And he came from out of state. He seeked us out from out of state because I think clinic he went to closed or retired or something. And so, yeah,
that was cool.
that was a cool one. Okay, I think.
Anything else?
Yeah, anything else, Mark? I think.
Like how many are viable? Yeah, I know exosomes though are non-living. I don't know that question, honestly. I don't know if there's a way to know that.
No, there isn't a way.
Because like we don't get a viability. Like
No.
I get everything they're tested against, but I don't get, there's this percentage of viability
Mhm.
in our exosomes. But I think that's because exosomes are non-living. I don't know for the others.
Yeah, I mean, I always, to dumb it down, really, I just say, put them in, they start attaching to their worst areas, and once they're done, they move on to the next, kind of thing. But no, there isn't a way really to tell. I mean, a question just popped up is that people usually will ask is, do you have to match it to my blood? And you don't.
Yeah.
You don't have to match it to blood type.
I've never got that question, but yeah, we don't. 'Cause there's no red cells.
Any other questions, Mark? It's about 750 million. I, I,
No way.
I have no idea. No.
I mean, we could reach out to BD Lab and
Yeah.
ask them.
Yeah, we can ask Viti. I've never had that question ever.
We'll look into that.
Yeah.
Thank you.
Okay, I'm gonna close it out then. All right, I think that kind of answers a lot of the questions that we've had patients ask over the years here. So, anything else that you want to add, Amanda?
I think you were mentioning the one thing that you get asked is, do you have to match my blood type for the stem cells to be used? And the answer is no. There's no red cells involved in the exosomes or stem cells, so there's no need to do any type of blood matching.
Yeah, that's excellent. All right, so stem cells, I mean, they're opening doors to healing that once seemed impossible. right? But Amanda, I mean, I'd like to thank you for sharing your knowledge and passion today. And today's discussion, I think, resonated with myself and a lot of people. But please subscribe to the Healing Wellness Show on Spotify, Apple Podcasts, or whatever you enjoy your podcasts on. And follow us on social media for updates, wellness tips, and more inspiring health journeys. Until next time, take good care of yourself and keep thriving.